Start the recording. Okay, so hello everyone. My name is Panian Rafi, and I am the member secretary of ISAM-NExT. ISAM-NExT is the one of the newborn committees of International Society of Addiction Medicine, ISAM, and it stands for New Professionals Exploration Training and Education. Welcome to the first webinar, first joint webinar of ISAM-NExT and NECPAM. So we are hosting the first webinar. NECPAM is hosting the first webinar, and and the topic would be about the reasons that some addiction medicine professionals became interested in this career. So first of all, I'm going to go through some housekeeping notes. This meeting is being entirely video recorded, and we're intending to share the video recording on our social media platforms. So if for any reason you wish not to be in the video recording, you can keep your webcam off. And else is about the your microphones. Please make sure that your microphone is on mute when the speakers are talking, so that's not going to be distracting. And you can use the chat box to post your questions and comments and any useful links or other things that you may share with other participants. And the last thing is about the Q&A session that we're going to have at the end of the webinar. So you can use the raise your hand handle there to ask your questions. So you can briefly take a look at the webinar agenda here. We're going to introduce the webinar, and the chair and co-chair of ISAM-NExT and NECPAM are going to give their messages briefly, and then we're going to have 4 presentations by ISAM-NExT members, and then at the end of the webinar we're going to have a discussion and a Q&A session, and we're going to conclude the webinar. So I am going to introduce first the ISAM-NExT chair and co-chairs. First, we have Dr. Roshan Bhatt here as the chair of ISAM-NExT, and Dr. Hossein Mahadasardibili here as the co-chair. Also Dr. Sofia Ekab is another co-chair of ISAM-NExT, but we unfortunately do not have her here today. So I ask Dr. Roshan to start giving the message as the chair of ISAM-NExT. Thank you.
Thank you, Panian, for introducing this webinar. This webinar series, it's a first collaboration effort between ISAM-NExT and we are very fortunate that chairperson of NECPAM, that is Dr. Nirvana Morgan, and Dr. Paolo Grandinetti, co-chairperson. Both of them are here to chair this session. It is my privilege to introduce Dr. Nirvana. She's a psychiatrist from South Africa, currently located in Germany, pursuing PhD, and she needs no introduction. She has published a number of papers and winner of many awards, and she is chairing NECPAM for almost now a couple of years now. Dr. Paolo is a co-chairperson. He's also ISAM-NExT member, and he's a psychiatrist from Italy. He's also pursuing PhD, and it is my honor that they are here to chair this webinar. So I would request now Dr. Nirvana and Dr. Paolo to proceed, please.
Thank you so much, Roshan. Can you all hear me clearly? Okay. And thank you. I think this is such an important collaboration, and this idea of peer education to early career professionals is something that we particularly passionate about. I'll go straight into just introducing the topic once again. So why did I choose a career in addiction medicine? I think is thank you to ISAM-NExT for initiating this as the first webinar topic, incredibly important. For those of us working in addiction medicine and doing research in the field, you know that one of the biggest challenges is capacity building, having enough people to work in the field in order to serve the population of people with substance use disorders. And so I'm hoping that during this this webinar, any undergraduate, postgraduates that are listening will be encouraged. There's several barriers often to entering the field of addiction medicine. Some of them are often training opportunities. We also know that people working in the field, from research that shows that there might be issues of stigma about why you've chosen the field. And so I really hope that this will open up conversations and discussions about working in addiction medicine. For those already working in the field, perhaps this will also be a time for you to reflect on your own journey by hearing these speakers. And additionally, you could hear about other training opportunities and other pathways to training in other countries. So we're going to start with our incredible lineup of speakers. And first up is going to be Laura Orsolini, and my co-chair, Paolo, will be introducing her for today. So I hand over to Paolo.
So thank you, Nirvana, and good morning, evening, or what else to everybody. It's a pleasure for me to introduce, first of all, one of my friends, Laura Orsolini. She is a medical doctor, of course. She's a psychiatrist. She is a researcher. So as you can see from her first slides, she is very active and since the beginning of her career, she was involved in addiction medicine. And so I invite Laura to give her talk to us. And please, Nirvana, Laura.
Thank you, Paolo, for the presentation. Thank you to all. Good evening to all from Italy. It's a great pleasure to be here and to represent the ISAM-NExT. And I would like to thank you also, Nirvana and Paolo, as representatives of the NECPAM. It's a great pleasure because you're asking to me to talk about my personal experience, my history, and to answer the question, why did I choose addiction medicine as both clinical and research career? Why, how you build a clinical and a research career in addiction medicine, addiction psychiatrist? You should be very lucky. You should be very lucky to meet a good mentor, an empathic, passionate, and energetic mentor. And you have to be lucky to receive a good quality of mentorship. And this is not easy. And you have to be very willed, very passionate in working this career in addiction, and this is not easy because many universities across the European countries, in Italy in particular, are not so well prepared and so skilled in giving you a training in addiction psychiatry, in addiction medicine. So you have to be very willed about this. And you have to do a very hard work. More of this work is relating to your attitude towards self-training in addiction, because you may not encounter so many people, so many mentors, so many senior psychiatrists that are more prone to teach you about the addiction. And you have to be very lucky to live and to grow in a favorable environment, academic environment, both clinical and academic environment. And I would like to start by telling you my history and how I choose addiction medicine. I perfectly remember the day in which I met who will then become my mentor, who is Fabrizio Schifano. That is, who is a psychiatrist, pharmacologist, toxicologist, an Italian psychiatrist who decided to go abroad, so outside Italy, and who working in the UK. When I heard his talk, and I perfectly remember that I was so fascinated about his capacity to drive his passion and his interest in the addictions. I found that his passion was extremely contagious. And I was so motivated to deepen this aspect also in my career. I perfectly remember that I was young, and I was in my second year of psychiatry trainees, and then I decided to go abroad in the UK at the Psychopharmacology, Drug Misuse and Novel Psychoactive Research Unit at the University of Hertfordshire in Hatfield. And then I had the possibility in London to meet other colleagues, other very passionate colleagues, young psychiatry trainees like me. And together with them, I built within the European Federation Psychiatry Trainees, that is an association who collects many psychiatry trainees across the European countries, the EFPT working group specifically dedicating in the psychoactive substance use disorder. And as you can notice in this photo, we were only 8 persons who were interested in the addiction. And we were the possibility to meet many psychiatry trainees in London during the EFPT conference, but only 8 persons were interested in the addiction. And then we decided to build this group and to answer to these main questions regarding to how we can implement the training in addiction psychiatrists, both in the child adolescent psychiatrist and in the general order psychiatry, and how we can understand better the European level of the training in the addiction, and which is the level of the knowledge in the addiction psychiatrists across European countries, and how we can investigate the level of the attitude, perception, and feelings among psychiatry trainees toward the addiction medicine and addiction psychiatry. And we did a survey, and we collected more than 1,000 answers by psychiatry trainees, both CAP and GAP. And as you can notice, we collecting data from different European countries, and we discovered that there is great problems, many problems relating to the perception toward the addiction psychiatrist. One of these is relating to the experience of psychiatry trainees, European psychiatry trainees toward the training level. So we discovered that more than one half of trainees spend part of their training in addiction, but among those receiving training in addiction psychiatrists during their psychiatry trainees, 33% stated that their training was not well structured because it is too short or without a specific supervision or mentorship program, and these trainings were mainly constituted by an observership experience. Or other problems is relating to the perception psychiatry trainees towards the field of addiction. Many of them are not so very enthusiastic doing after their formal training programs a career, a clinical career in the addiction. So maybe the stigma began from ourselves. We are not so prepared training, so skilling in the addiction, but we are not so well prepared in the addiction field because we don't have a good mentorship program or a good possibility to deepen this aspect of psychiatry. And in Italy, the situation, is, as Paolo can say as well, is extremely heterogeneous because we have within our psychiatry training program a part that is dedicated to the addiction field. So theoretically, we should have an experience, both practical and also theoretical in the addictions, but not all the university are formally skilled in giving us this type of training. So the situation is extremely dishomogeneity, and we don't have a subspecialty in the addiction like many other European countries. So we have the CAP, the Child Adolescent Psychiatry subspecialty, and we have the General Adult Psychiatry subspecialty, but we don't have an addiction psychiatry subspecialty. So what we can obtain in order to deepen this aspect is a master degree or a post or a doctorate program, or we should go abroad, Italy. And another problem is relating to the huge splits that we have in Italy between the psychiatry and the addiction psychiatry. So we have the colleagues working in the psychiatry, in the mental health care, and we have colleagues working in the addiction psychiatrists, and there is a huge conflict between these colleagues and these two fields. And for this reason, many of our patients who have a dual diagnosis may be not adequately followed by both services. And another problem is relating to the lack of a specific programs in mentorship in the addiction psychiatrists. So we need to implement the addiction training programs, and we have to obtain a more homogeneous situation across European countries, but also in Italy. Thank you for the attention.
Thank you so much, Laura. Very interesting, and I also find it interesting coming from training in Africa to hear that so many similar problems exist even in Europe, in very high income countries. And I also want to say that you as an early career psychiatrist working in the field is also contagious and inspiring to hear what you've achieved and the research and setting up the subcommittee at EFPT. So thank you for sharing part of your journey with us. We're going to keep questions for the end, and I'm going to introduce our next speaker now. Our next speaker is Vicky Phan, and she's from Australia. Vicky has experience working across alcohol and other drugs, as well as mental health services in both New South Wales and Victoria. She believes in a holistic and person-centered approach when dealing or managing people and their families with substance use disorders. Her areas of interest include mental health comorbidities, harm minimization, pharmacotherapy, as well as training and education, which we've just heard is so important for ECP. So welcome, Vicky, and I hand over to you.
Thanks for that introduction. I'll just share my slides. I don't have too many of them here today. So hi, everyone. My name's Vicky. As has been introduced, I'm an addiction psychiatrist working in Australia. I do a 0.5 clinical job and a 0.5 academic job. So I also lecture for Monash University, which is one of our biggest universities in Melbourne here. And I'll be talking about addiction training in Australia. So I guess those of you who haven't had the chance to travel to us, hopefully you will in the future. This is Australia here. A bit about myself. So I grew up in Sydney, which is probably the city everyone knows because it's where the Olympics was a few years ago. But I did my medical training in Newcastle, which is a really lovely beach town 2 hours north of Sydney. And now I work in Melbourne, which is in our southern state, Victoria, and has a bit of a European feel to it, actually. So it's actually quite nice to hear from our European colleagues today. So I guess I ended up in addiction completely by chance. I was one of those medical students who didn't think they were going to do addiction when they left university. I thought I was going to specialise in public health training, actually. And the way they structure intern training in New South Wales is or in New South Wales and Australia, is that they want you to have core terms in surgery, in medicine, in emergency, and 2 other terms. And one of the terms I got as one of my 2 other terms was the detox unit. And that really changed and shifted my opinions about addiction. I think, unfortunately, there's a lot of stigma and prejudice that happens in the media and in our general population about what people experiencing addiction look like and how they engage with people and how we can help them. And it was just really eye-opening and really lovely to see that these people in detox were just such interesting people and such nice people who just had a really rough trot and just ended up with addiction for sort of no kind of fault of their own. They just sort of ended up there, and they were really appreciative of the help they got. And it was really nice to see them make such positive changes and have hope for the future as they recovered through detox. Very similar to Laura, I also had the very lucky situation of having good mentors and good people in front of me to demonstrate what a career in addiction could look like. I think that's one of the things that's really mentoring in education is so important as a junior. If you've got someone in front of you who's doing a really good job and inspires you, then you kind of want to emulate them. And I think that really shifts someone's opinion about a specialty. So I was very lucky to work with some professors and some really eminent researchers in the addiction space who had a really lovely patient interaction manner and were really passionate about what they did and really open-minded. So I just kind of thought, this is my tribe. These are nice people. These are nice patients. This is nice healthcare to be delivering with good outcomes. So sign me up. I'll stay in clinical medicine and not go to public health. So that's how I ended up in addiction training. And I ended up doing addiction psychiatry rather than addiction medicine because we have 2 pathways here in Australia, which I'll explain later. But the reason I decided to go down the psychiatry route was because I found it really frustrating that there was so much trauma and anxiety and depression that was reasons behind why people were stuck in addiction and using alcohol and other drugs or gambling or other addictive behaviours. So I felt that to do justice to the patients and to be satisfied as a clinician, I really wanted to be able to manage both the mental health issues and the addiction issues, which is why I've ended up doing addiction psychiatry. So I guess hearing about Europe, it's really interesting. So in Australia, we had very similar issues with training in addiction. It was kind of the frowned upon cousin in medicine for many decades before us, and there was lots of stigma and people weren't really interested in training in it. There was a bit of a shift from the start of the 2000s. So at the start of the 2000s, our College of Physicians here, which the Royal Australian College of Physicians, they really sort of worked hard to establish a faculty or a chapter of addiction medicine within their physicians training program. And as part of that, they worked out a grandfathering scheme where they essentially grandfathered a bunch of doctors who'd been essentially practicing as addiction specialists to become registered sort of recognised addiction specialists to make sure that they were able to train people. And then the training program got established and then psychiatry followed shortly after. So we now have 2 medical colleges which oversee training for addiction in Australia. I'll speak to the one that I did first, so addiction psychiatry. So we have a Royal Australian and New Zealand College of Psychiatrists. So anyone in Australia and New Zealand who wants to become a psychiatrist goes through this training program. Essentially, to get to this training program, you need to finish medical school, at least do your internship. Some people do residency, some people do a couple of other years, and then you interview and you submit a resume and you get experience to be accepted into a psychiatry training position. Psychiatry training in Australia is minimum 5 years. On average, it's a little bit longer than that for multiple reasons, like people going part-time, maternity leave, time off for research, that kind of a thing. But if you have a nice smooth run, then it's 3 years of basic psychiatry training. And in your last 2 years, you can subspecialize in specialties like addiction psychiatry, child and adolescent psychiatry, that kind of a thing. So the advantage of this is that we have a clear curriculum across Australia and New Zealand, which helps with mobility of people too. If they want to work around different states or if they want to work across countries, it's recognised across both Australia and New Zealand. And if you're a trainee, it's also a benefit because people don't have to stay in the one state. They could, for example, start their training in New South Wales and then move across to Western Australia, for example, and continue their training there, which is really nice. And the ability of the colleges to have established certificates of advanced trainings and curriculums means that we now have consistency in the core knowledge and skill set that people who qualify as addiction specialists will have in Australia, which is really good as well. And that also provides reassurance to community that people working in these positions have had appropriate training and are performing at a kind of peer reviewed standard that would be acceptable. So this is the addiction psychiatry training. The other way that we've got is through the College of Physicians. So a lovely way about it is that in Australia, there's kind of two ways to become an addiction specialist. And we tend to call everyone who is a specialist in addiction an addiction medical specialist, regardless of whether you're an addiction medicine physician or an addiction psychiatrist. It sometimes seems a bit confusing, but I think it works quite well because the psychiatrists have a bit more of a kind of mental health background and are more comfortable managing those sort of co-occurring issues, whereas the physicians will have had a lot more exposure to specialties like infectious disease and gastroenterology. So it kind of diversifies the group of specialists around, and particularly if you're working in a health service where you have both addiction medicine specialists and addiction psychiatrists, it means that we can do a lot more in-house because we have diverse skill set amongst us. So to do addiction medicine training, essentially people go through, for the most part, physician training, which is general medicine. They'll go through medical school, at least internship, at least residency in core terms that are required. And then from there, they will apply to get accepted into the physician's training program, where they'll move around in specialties like neurology, respiratory, nephrology, and so forth. And then in their last 2 years of physician training, which is also about 5 years, they can specialize in addiction medicine. The physician training program also has the ability to recognize people who have fellowship with other colleges. So rather than going through the basic physician training where you get broad experience across all kind of medical specialties first, if you have fellowship and qualified as a specialist in emergency medicine, anesthesia, intensive care, psychiatry and general practice, they recognize that you've had that background training and you get to skip basic training and go straight to the subspecialty training in addiction medicine. In Australia, there's probably more addiction psychiatrists at the moment, just by way of training positions. There are more funded addiction psychiatry training positions in quite a few of the states than there are addiction medicine, which is something we're trying to work on. Like has been mentioned before, one of the issues or the bottlenecks to us getting more addiction medical specialists out there is the limitations in accredited trainee spots and also accredited supervisors to oversee those trainees. But that's something that we're working on. And there's been various mental health commissions and things in Australia recently, which have been quite eye-opening for the community and has helped us to advocate and lobby to government around creating more positions and getting more funding for that. So that's a snapshot of the training in Australia. I guess in terms of things that have been good about training in Australia in addiction, I guess that there is this nice framework for training now, that there's lots of opportunity for Australian doctors to meet each other, and there's subcommittees and faculties across the nation that people will gather at, so that addiction specialists, regardless of where you are, get the opportunity to meet and work on projects together, like medicinal cannabis and psilocybin research, the very trendy areas in Australia at the moment. Limitations are definitely the barriers to training. We would absolutely love to have more specialists. We need more specialists in Australia as well. And one of our biggest areas is actually getting enough in our rural and remote areas. As you've seen, Australia is really big and we all tend to live on the coast, but we also have people in the middle and outside of the coast that really need addiction care. And we do experience a lot of trouble getting addiction specialists to those areas to make sure that health is equitable. So we need to work on that, or make the bullet trains in Japan come to Australia so we can get around a bit easier and provide that care to people. So that's Australia, and lovely to meet you all.
Thank you, Vicky, for your presentation. Here we have the youngest addiction specialist in Italy. As you can see now, Laura's daughter is on. Okay, so many thanks, Vicky. I think we are few minutes late, so I will introduce immediately our um, last man standing because I'm very happy that there are many women talking today. So um, Dr. Venkata Narasimha, I hope that I pronounced it well.
Yeah.
He is assistant professor in psychiatry at the All Indian Institute of Medical Science in Deoghar, India, and he's a ISAM-NExT member and also NECPAM member. So I'm very pleased to introduce his presentation. So please.
Thanks, Paolo. So let me share my slides. Yeah, good evening, everyone. So I hope you are able to see my slides. My audio is also clear.
Yeah. Please go
Okay.
on.
Yeah. So why did I choose choose addiction psychiatry as my career? So before that, the question comes: why did I choose psychiatry as my career? So it was more of a accidental rather than planned. So when I was doing my internship, I actually chose radiology over psychiatry, and I skipped my psychiatry posting. So when I prepared for my residency exam, the first branch that I got was psychiatry in May of 2013. Then I was actually very much interested in doing surgery, which I'll be getting in July of 2013. So then I thought, okay, let me join an institute of psychiatry and see how it looks like. So then I joined this institute, which is National Institute of Mental Health and Neurosciences, Bangalore, which is one of the lovely place on the earth. After joining this institute, within 2 months, I fell in love with psychiatry. I never looked back. I actually denied the residency that I got in surgery, and I continued in psychiatry. So before that, I never thought I would become a psychiatrist at any point of time in my life. But after taking psychiatry, I never looked back. So as a psychiatric resident, I was posted in addiction. So we have a separate addiction psychiatry unit, and I was posted in my final year. So one thing that attracted me was in my center, there used to be a lot of cases of delirium tremens, alcoholic hallucinosis, pellagra, and we used to give them diazepam, and they used to improve significantly. Within a span of 2 or 3 days, they used to improve physically and psychologically. And there used to be a lot of cases of cannabis, psychosis, which used to melt within days. And people on OST treatment, they used to stay abstinent on substances, and there are a lot of doctors who continue to stay abstinent and used to do surgeries after being on OST for 7 years or even more. So at the time, I didn't understand that it is a chronic relapsing condition, but still, these are some things that attracted me. Fortunately, I was under the guidance of best teachers in the country. So that was one thing that has actually encouraged me to take addiction psychiatry in coming days. So I have again joined a fellowship in addiction medicine. Then I thought, okay, I will do a fellowship for 1 year and I will leave addiction and I will continue my general psychiatry practice. I will have little experience in addiction. Then after joining fellowship, then again I got even more attracted towards addiction psychiatry, and then I decided, okay, I'm going to join my DM. So this is my de-addiction center in which I worked for almost 4.5 years, and these are some of my colleagues. So when I joined DM in addiction psychiatry, which is a 3 years course, so I can tell that is one life-changing thing that has happened. So during these 3 years, I was not only trained in terms of clinical skills, but also in terms of research and academic skills. So during this time, one of the things that I did was community-based research. So I have gone to Bangalore-based slums, try to understand try to understand the treatment needs in terms of alcohol use disorder. And then what I understood was there is a lot of treatment gap. So in India, the treatment gap for psychiatric disorders is around 70%. When it comes to substance use disorders, it is around 80 to 90%. So when I went door to door, looking at the what are the treatment needs and what is the reasons for treatment gap, what I understood was most of them doesn't know that treatment exists. Even though they wanted to take treatment, there is a lot of stigma. Even if they overcome stigma and wanted to come, there are no health facilities which are nearby. So which made me think further, and this is something that actually made me to stay back in academic institutes. And one of the important things that happened is that I wanted to train more people. So this made me to continue in academic in terms of one of my life goal is to look at the ways how I can reduce the treatment gap, especially in my country. So last year I finished my DM in addiction psychiatry, and here is my colleague who finished DM along with me, and she is Professor Pratima Murthy, who was my guide, and she was one person who has inspired me so much to continue this work. I can tell she as a mother of addiction psychiatry in India, because she has been mentor for so many people. So these are some of my publications, most of them focused on alcohol related publication, some of them on policy related changes, like there has been a lot of policy related changes that happened during elections, also during alcohol ban that has happened during COVID. So most of my research was focused during around these areas. So coming to training in addiction in India, when it comes to UG training, it's almost minimal for psychiatry, and it is very, very minimal for addiction. There are hardly 35 hours of classes for UGs and 28 days of clinical posting and 15 days of internship. There was a new National Medical Commission that happened in 2018. So we are expecting that the time for psychiatry will increase, thereby increasing time for addiction training also. When it comes to PG training, in terms of psychiatry, it is very heterogeneous, and most institutes doesn't have any separate addiction units, and institutes with addiction unit have 3 to 6 months of posting, and institutes without unit, the training is part of general psychiatry, and some are posted to institutes for 15 days to 1 month. So these are post-residency training programs for last 10 years. So there is a specialized addiction psychiatry training after MD, which is for 3 years. At least 4 institutes at this point of time deliver around 9 seats per year. And there is a postdoctoral fellowship in addiction medicine. This is there in NIMANS, Bangalore, and there are 2 seats. And recently, at least for last 5 years, there has been certification course, online certification course, which lasts for 6 months, which have been done by NIMANS Digital Academy. For each course, there are around 100. So, and along with that, there are PhD courses which are for 3 years or more, which are there in some of the institutes. There are also short-term observership programs which are offered by Indian Psychiatric Society and also other national institutes. Again, the number of seats are variable. So this is NIMANS Digital Academy virtual knowledge network, which is actually running various courses for health professionals. So there are around 4,000 health professionals that has been trained in last 5 years through this digital platform, starting from counselors, psychologists, psychiatric nurses, also psychiatrists, other medical branches also got trained to do this. So if you see in 2021, there has been basic course on addiction management for lay counselors, psychologists and psychiatry workers, and advanced course for addiction specifically for psychiatrists. This is 6 months course. And there are also courses that are happening for hepatologists in terms of alcohol use disorders. So the digital platform that has been started in the last 5 years has been able to reach a lot of health professionals in the country. So almost 4,000 plus health professionals have been trained in addiction with this digital platform. So what has happened in the last 10 years? In the last 10 years, before 2010, there are no specialized training. In the last 10 years, we have multiple training programs, and more than 50 specialized trained addiction professionals across the country are there. So what is the way forward? We are very optimistic. We are going to train more and more people. More and more training institutes are coming up. We wanted to attract more young health professionals into addiction psychiatry or medicine. And we are also active in a lot of groups like ISAM-NExT and NECPAM. And we have also formed the Addiction Psychiatric Society of India, and Addiction Division of Indian Psychiatric Society is very active. we have very good mentors across the country. All has the common goal to improve addiction psychiatry services in India, and we are very much optimistic about India's role in addiction psychiatry or medicine in coming years. So this is my story and India's story. Thank you.
Thank you so much, Dr. Narasimha, for sharing your story. I find it interesting that even as the third speaker now, we hear this common thread that a good mentor is just so important in this pathway to getting into addiction medicine. So I think that definitely is something that's standing out to me. And I also just want to congratulate you on your really great hands-on experience. I like those pictures of you in the slums going from house to house. And I think as a clinician researcher, the value of that experience and how much more you can add to the research space as well as to clinical space, that's amazing. So congratulations on that and all your achievements thus far. I'm going to move on to our last speaker, which is Dr. Jenna Butner, coming all the way from the USA. Dr. Jenna Butner is an addiction medicine and family medicine physician, and she's been born and raised in New York City. She completed a residency in family medicine and has completed 2 fellowships in hospice and palliative medicine, as well as an addiction medicine fellowship at Yale University School of Medicine. She's passionate about treating hepatitis C and HIV in patients with substance use disorder. We also know that her treatment approach to substance use disorders is particularly through harm reduction model, and she's a big advocate for decreasing stigma of substance use disorders and mental health. What I found particularly interesting in your bio, and I hope we hear more about this, is that you're also a certified yoga instructor with additional training in 12-step and trauma-informed yoga. So maybe we will learn a little bit more about this in your talk. I'm going to hand over to you, Jenna.
Okay, good morning, everybody from New York. Apologies in advance, there will be some background noise, so just bear with me. Pernian, are you sharing the slides or?
Is it possible for you to share a screen, or I can also, I have your slides as well.
Yeah, please.
Okay, sure, so just a second.
Well, I'll just get started talking here. Thanks also, first off to NECPAM and ISAM-NExT for Sham Parnian, Nirvana, and great presentations by Laura, Vicky, Narasimha. It's really interesting to hear about what's going on in the rest of the world. And today I'm going to just give you a quick snapshot of pathway to practicing addiction in the US. But I'd more so like to just focus on like my pathway and how I came to do what I am doing.
1 second, and it's going to be on the screen.
Okay.
Okay, so are you seeing the slides right now?
Yes.
And it is in the full screen mode right now, right?
Perfect. Yeah, thank you. All right, we can go to the next slide.
There you go.
All right, so why addiction medicine? There are so many reasons why I went into it. And as Nirvana said, so I trained in family medicine. I trained in the South Bronx. And for those of you who do not know about the Bronx, it's a very low socioeconomic area and very high rates of substance use, mental health. And I felt that during my training that as a physician, I had to learn about this in order to serve my patients as if they had any other chronic condition. And I should also just start off by saying that it's, as to echo what everybody else has said, it's really important to have a very good mentor. And mine is on here today, Dr. Jenna Butner, so thank you. So after family medicine, I went into palliative care and hospice. And there I also saw this unmet need for pain management for people who were involved with palliative care who had comorbid substance use disorders. So that really got me interested. And, you know, from there, I just happened to apply for a fellowship for addiction medicine, and really, why not, right? So what I love about addiction medicine is that it's really just a patient-centered care. As Nirvana said, I'm really focused on harm reduction and really just advocating for my patients who are really just marginalized. And as we know, stigma exists around anything addiction related. And it is one of my goals is to just decrease stigma and, you know, present to medical students and just teach about appropriate language to use. So I think also just to say, you know, working with this patient population, for me, it's just truly a privilege. It's a very, as everyone knows, very sensitive topic. And, you know, for somebody to let me in to their lives to help them is the best gift I can get. As others said, it's really a special community. I highly recommend going into a like academia setting so that you can learn from so many amazing researchers and clinicians, and just this unique knowledge sharing. So many addiction organizations here in the US, MRSA, ISAM, where you can really just network and just learn just all the time. As I said too, you know, it's this kind of movement for social justice and focus on public health. As maybe if you didn't hear, just actually earlier this week, the CDC posted news that there is, you know, we've had the highest overdose rates in the last 2 decades in the US. So, you know, we really need to start, you know, saving some lives. And, you know, it's inspiring for me. It's a treatable condition and it basically saves lives. Next slide. Okay, so interestingly enough, it was recently National Doctors Day in the US. And my program at Yale had asked the previous fellows to say, you know, why addiction medicine? And this is what I wrote. You know, training to become a physician, we learn about heart disease, diabetes, and I felt, you know, to not learn about treating addiction disorders, it's basically a disservice. And, you know, we need to take responsibility and practice our due diligence as medical providers. Secondly, it is the most rewarding field of medicine I have ever practiced in. And, you know, I'm just honored to be a part of my patients' care. The next question that they had asked, next slide. The next question that they had asked is what advice do you have for others considering a career? I think it's a fascinating field. It's constantly evolving, and it's really one of the most exciting movements to be a part of, not only nationally, but with the international community, with all of you here. And the advocacy for our patients decreasing stigma is one of my motivating factors to go into this field. And as I said, you know, finding a mentor, as I really, you know, humbly and gratefully did, it will help you so much on your path. And I highly recommend, you know, finding somebody that, you know, you can learn from and just grow with. Next slide. So pathways for physicians to become a specialist in the US. I just want to note this is for physicians. We have so many in the US, it's a lot highly multidisciplinary, where we work with nurse practitioners, physician assistants, RNs, and this is specifically for pathways for physicians to become specialists. So just general requirements, a medical license, so just unrestricted valid license to practice in the US. A medical degree, so this can be obtained either by going to an actual medical school that's accredited by the LCME, an osteopathic medical school, or a medical school located outside the US and Canada that is deemed satisfactory to the board. So of note, I actually, I am considered a foreign medical graduate because I did go to medical school outside of the country. I trained in Mexico and I got my degree from Ross, which is a school in the Caribbean. So I, am able to continue on this path, even though the school is located outside the US. Next slide. So this is the best part about addiction medicine in the US, if you ask me, is that you have to have a primary board certification. So what does that mean? So any of the, I think it's 24 specialties, so you can go into OBGYN, pathology, pediatrics, sky's the limit. And that is the requirement for doing an addiction medicine fellowship. Whereas other training programs, like for example, addiction psychiatry, you have to have done a psychiatric residency in order to do that. So I want to note that it's really a really dynamic field that it incorporates all different areas of medicine, and you need a current ABMS member certification. Next slide. So pathways, so pathway requirements. So this has been an evolving field in the US. You can, so there's one way to do a practice pathway.
No.
Okay, so there's one way to do practice pathway, and this is through 2025, and this is meeting a set required amount of hours. You can also go the ABM diplomat pathway, and this requires you taking the addiction medicine boards, or you can do the ACGME accredited fellowship pathway. And this is what I did. And I highly recommend just involving yourself in an academic setting and just learning, from the best of the best, which I had the privilege of doing. Next slide. Currently in the US, there are 83 addiction medicine fellowships throughout the US. There is a medicine certification exam. And interestingly enough, within the last several years, the board certification is now through the American Board of Preventive Medicine. So there isn't a addiction medicine board that can, I guess, certify you. It's through the ABPM. And the beauty of addiction medicine here in the US, there's a lot of opportunities for rural setting, public health, specialized settings. And, the training incorporates, outpatient programs. I'm very interested in infectious disease, so co-located care for hepatitis C, HIV treatment, working at different methadone programs, inpatients, and so many other settings, which just really just is, enhances everything. And then the other, so in the US, there's a real divide, if you ask me, between addiction medicine and addiction psychiatry. So as I mentioned, for the addiction psychiatry pathway, you have to have done a general psychiatry residency training and take a different board certification in psychiatry from the ABPN, and then the addiction psychiatry. This is the pathway I did not take, but it is another route for addiction certification in the US. Next slide. And as I said, having a mentor for me, Dr. Jenna Butner, who I met when I did my fellowship, she's been really just incredibly instrumental, and the reason why I've really stuck with addiction medicine. And my patients who I learn from every day, I can learn much more from them than a textbook, and I'm grateful to be part of their care. And that's all I have to say.
Thank you so much, Jenna. I have to also agree with all of our speakers today that really what came out is that there's such a sense of job satisfaction that you can experience in addiction medicine, which is so different, I think, to what the perception can be before you enter the field and before you encounter a patient. And I also want to say that I think the community of people working in the field is just amazing. From joining the field, going to conferences and meeting people in NECPAM and ISAM and having conversations, I feel that people that tend to be attracted to working in addiction, there's something amongst the professionals that we have quite similar, and we're able to connect on a very soulful level quite often, which is something I enjoy as well about working in addiction. We have some time for questions, so I want to give the audience an opportunity to ask any questions. I don't see anything in the chat, but if you'd like to raise your hand, we can, or unmute yourself. Paolo, do you see any questions?
I think there is a question from Olo One Oyedoji. I am a trained psychiatrist from Nigeria. How can I get trained to become addiction psychiatrist? He said also that he attended several seminars organized by UNLDC in his country. So can someone of the speakers would like to reply?
Anybody familiar with what's happening in Nigeria? Probably not, I would say. Well, I had some training in South Africa, so I will just share some thoughts around that. I think especially in developing countries, it's a very structured, consistent training program, like we've heard from both Australia and the USA, doesn't always exist. And if I had to just talk about how I went about it in an area where there isn't a very structured training program, would say that I had to navigate things a bit on my own. I found a good mentor and I reached out to international communities for extra training as well. I found that when you go via research route, like I did a PhD in addiction medicine in South Africa, I was able to find a lot of people, not just from the clinical point of view, but from a clinician research point of view that could mentor and help me along the way. In South Africa, there are some training opportunities in another province from which I lived. And sometimes if you have the opportunity, you might have to move, to get that training. And as Laura said in her first presentation, sometimes you feel incredibly lucky. I think she mentioned that a couple of times. She was lucky to have a good mentor. She was lucky to experience a good training opportunity. But I do believe that if you have the passion and the interest and you immerse yourself, you will find it, And perhaps if you could send an email to contact@necpam.com, we can link you up. We have quite a few members from Nigeria. I think we'd be able to, link you up with other people in Nigeria working in addiction medicine, or even just in Africa, and set up a conversation and see how we can guide you on your training journey. Are there any other questions from anyone?
There is another question from Abhishek. Can you please elaborate on difference in addiction psychiatry and addiction medicine from a training perspective? So it's an interesting question.
Yeah. I think Jenna, you might be in a
good
position.
I can. It's a good question. I think the main difference is that with psychiatry, you're also you're just focused on treating psychiatric comorbidity and addiction, whereas in medicine, it's co-located care, it's multidisciplinary care. It's within medical units, treating infectious disease, treating adolescents. So it's a much more, if you ask me, more like biopsycho holistic approach to the whole patient, being able to care for them fully, versus the psychiatry pathway. It's just more focusing on the psychiatric comorbidity. And then the only difference in training is really what I pointed out on the last slide, with addiction psychiatry having to go through psychiatry training, and then with addiction medicine being able to do training in any subspecialty and then going into it. So for me, that's the most pronounced difference.
Vicky, is there anything that you want to add? Because I think Australia also has these two pathways.
Yeah, I think Australia is quite similar to the States, so I'd echo what Jenna says. The sort of core differences that we see is that your sort of foundation training rotations are different, depending on whether you're doing psychiatry versus medicine. Our addiction psychiatry and medicine trainees often come together in advanced training and work together in at least a rotation. So there is some shared training, but obviously an addiction psychiatry training will do things like an adult inpatient mental health unit, an older age mental health inpatient unit, and have exposure and awareness about how to manage those kind of situations, whereas a addiction medicine physician might work in the liver clinic or might work in infectious diseases ward. So the background differences there and the supervisors that you would get and the kind of research exposure and things are slightly different. But I think they're both valuable skill sets. I don't think anyone is superior out of the two. I think it's just what you're most interested in and where you want to focus when you end up being an addiction specialist.
Thank you so much for that. I think we've done pretty well for time. I'm just going to have a few closing remarks. I know that it's your weekend and everybody's in a different space right now. Thank you so much to our audience for joining. These webinars are for all of us as a community to connect and to share these experiences and to share education with each other. So thank you. Thank you to ISAM-NExT for this collaboration. I think it's been great. And there's going to be another webinar coming up pretty soon in September that NECPAM will be hosting, and it's a collaboration again between ISAM-NExT and NECPAM, so please look out for that. Thank you especially to our speakers for sharing your journey with us, for sharing, giving us your time. We really do appreciate it, and I'm inspired by each and every one of you. I hope to meet you all face to face because some of you I haven't met yet. So thank you so much to our speakers. Before I hand over to Roshan, there's just one more thing that I'd like to say while on this platform, that we can't ignore that all of us are working in this field that's incredibly difficult right now during a time of a pandemic. And I think possibly many of us have been part of publications talking about mental health difficulties in people working in mental health, amongst mental health professionals. So to anybody that's on this call that's struggling, you know, that finds that just working during this difficult time is taking a toll on you personally, on your own mental health, on your, you know, addiction-related issues. We know that that can be prevalent amongst healthcare professionals. Please reach out. We hear, I think that one of the main mandates of NECPAM and possibly ISAM-NExT as well is to support early career professionals. So there'll be email addresses. We can get you in touch with anyone of the names that you see on here. We'd really like to support you on your journey and make sure that it's a long-term journey. It's not one that you need to leave. So yeah, if I could just add that, hand over to Roshan to close today's webinar.
Thank you, Nirvana and Paolo. Panin is going to end, but before closing it, we need to take photograph also. And thank you for joining. Thank you, excellent speakers, and thank you for chairing the session. It was a good experience. Yeah, so Panian, over to you now.
Thank you so much. So all of the participants, we are going to take a group photo so if you want to be in our group photo, you may want to turn your webcam off on for a second and we can take a group photo together and then we're going to say goodbye. So we'll wait for maybe 10 seconds, waiting for you all to turn your webcams on and we can have a photo together. Thank you. Okay, anyone else wants to join us? Oh yeah, people are joining, okay.
Meanwhile, I've read another question from Sylvia, and I think that we can reply to her in the next webinar. So about the difference between addiction and social ritual, it's not very simple, and it's not easy to reply in a very, very fast way to this question. I think the two things are very, let's say, overlapping somehow. From a clinical point of view, I can say to Sylvia that if these social ritual became something that impact with the life of your patients, that means that it's a very big problem for him. So, but of course, addiction is part of our way of life if we think of smoking cigarette in the past, for example.
Great, thank you, Paolo. So I also take some photos. Thank you for joining us. And so as I told you before, we have recorded this webinar. So, and we would be more than happy if you want to share the recording with anyone that you may find who's interested in addiction psychiatry and addiction medicine. So I am sending our email address in the chat box. Some of you may not be already on our email list, so we're going to send you the link to the recording of this webinar in a few days, and we're going to also share it on our social media, our Twitter channel, so Twitter account. This is also our Twitter handle, and you may want to follow us for keeping up with the news and everything. Yeah. And if you have any questions or, you know, any suggestions, any concerns or things that you may want to share with us after the webinar, we will be more than happy to receive your feedback by you know, you can send us an email for that. Thank you so much for joining.
Thank you. Goodbye.
Bye-bye. Thank you.
Goodbye.
Bye-bye. Thank
Have a good
you.
day. Bye.
Bye. Thank you.
Bye. Thank you.
Bye.
Bye-bye. Have a good day all. Thank you for joining.